Is it true that companies in Nigeria who have Chinese citizens in their employment require a medical report from them before they are allowed to resume work?
On the 28th of February 2020, Nigeria recorded its first case of coronavirus in Lagos. Earlier today in Abuja, it was alleged that medical doctors at the National Hospital were issuing medical reports to Chinese citizens without carrying out a test to confirm if they are positive or negative for coronavirus. Roots TV is at the National Hospital to hear from the hospital management. Come with us.
On getting to the National Hospital, Abuja, we waited endlessly at the hospital to see a foreigner, be it Chinese, Italian, or Indian. Your guess is as good as mine. As curious as we are, we went around the hospital premises to survey the area to the best of our abilities. At some point, we spotted many no-go areas, but those I saw looked, spoke, and appeared like Nigerians. Luckily, at the hospital, we met the spokesperson of the National Hospital Abuja, whose words contradicted the allegations.
This is false allegation against the hospital. We are not testing anybody for coronavirus. We have not received any patient of coronavirus. And if you want to know anything about what the government is doing about coronavirus, you go to the Honorable Minister of Health and the NCDC, the National Disease Control. The one in charge of this issue about coronavirus, and so there's no any Chinese that's coming here to retest, and this is a government hospital with standards. We can never give any false result to anybody. Let's forget about Chinese or even anybody that comes here. We don't give false results.
As earlier reported, that the outbreak of then SARS and now coronavirus named COVID-19 by the World Health Organization started in Wuhan market in China, where the meat of living or dead animals such as dogs, hares, pigs, snakes, and a whole lot more are sold for human consumption. On the 1st of January 2020, the Wuhan seafood market in Wuhan was shut down. The first person to die from the virus was a 61-year-old man who was said to be a regular shopper of the Wuhan seafood markets. This has metamorphosed to become a global epidemic. As of today, 83 countries and territories around the world have reported a total of 95,064 confirmed cases of the coronavirus COVID-19 that originated from Wuhan, China, and a record of 3,249 deaths. Two days after Nigeria recorded its first case of COVID-19, President Muhammadu Buhari, in a statement issued by a senior special assistant on media and publicity, cautioned Nigerians against undue alarm, which he said would pose more mischief than good. The statement reads, President Muhammadu Buhari notes with sadness the recent confirmation of a case of COVID-19 infection in Lagos, Nigeria. This was despite the ardent efforts of the government regarding preparedness and response measures put in place in our country's borders and beyond. End of quote. The opposition People's Democratic Party on its part believed President Buhari did not allay the fears of Nigerians. They maintained that the president would have done justice on the global epidemic through a nationwide address. Roots TV did anyways. While the coronavirus spread has made its way into Nigeria, with renewed assurance from the government that it is ready and more than capable to deal with the spread, Nigeria has a population of about 200 million people. What is more worrisome is the healthcare system in the country, with a huge population. More so, looking at the Ebola virus outbreak, there appear to be no gains made or lessons learned for Nigeria to improve our healthcare facilities for her growing population.
In time of Ebola, in time of Lassa Vifa, even all these things, they are on that we did all our best. So it's a rumor, it's a false allegation. It has never happened in this place. We have not received anything about coronavirus. We don't give any medical certificate or clearance or anything to anybody on coronavirus. No Chinese has been here on that aspect. So please, the public should know and should be noted.
Lately, hand sanitizers, face masks, and hand gloves have been prized commodities in the market. Average Nigerians struggling to survive daily cannot afford these items to engage in the prevention tips while going about their everyday business.